Thank you for joining us for our discussion of the fifth part of the series, Nurses Touch the Leader. This presentation was created by Luke Sanborn, myself, Sanveer Sangha, Lucy Tikelian, Tamara Wilson, and Matthew Yoder. Previously, we've seen the sections of Managing the Team, Client Safety Event, Interprofessional Communication, and Quality Improvement discussed. Today, we'll be discussing the segment regarding interprofessional team leadership. Before we get started, we'd like to introduce you to the characters involved in the segment. We'll be moving from the top left to the bottom right. To begin, we have Beverly Brown, a registered nurse on a medical surgical unit. She has 20 years of experience as a medical surgical nurse and has been a charge nurse for the past 10 years. She is mentoring Cynthia. Cynthia Snyder is a newly licensed registered nurse. This is her first job as a nurse. She is working on developing her clinical judgment and leadership skills. Dwight Sanchez is the nurse manager for this medical surgical unit. He is an experienced nurse and has been the manager of this unit for the past 5 years. Margaret Neely is a case manager who began working at the hospital as a staff nurse 30 years ago. Her role is to ensure that client care is provided in the most appropriate setting with consideration for healthcare costs. Patrick Kelly is an orthopedic surgeon and chief of the physician staff. He is passionate about ensuring his staff adhere to evidence-based practice standards to promote positive client outcomes. Maria Cruz is a registered pharmacist. She works within the healthcare system to ensure the safety of clients' prescribed medications. She also assists with coordinating discharge medications and client education. And then finally, Bailey Jones is a physical therapist who assists clients with conditions that affect their mobility and strength. Her care provision focuses on exercises and education to improve balance, movement, and flexibility. Now that we're familiar with everyone's role, we'll move on to the actual case study. Margaret Neely is the case manager and the leader of the team. She discusses decentralized management with Cynthia and the concept of case management and use of clinical pathways with the team. Margaret uses her knowledge of change theory and her listening skills to guide the team in the discussion. After the meeting, Margaret reflects on the events to gain a better understanding of the group and to plan for future meetings. For a better sense of understanding, we've included the actual video of this scenario. In this video, we'll see how Margaret confers with Cynthia her plan to propose certain changes in a subsequent meeting with a multidisciplinary team.
Hi, Margaret. Are you ready for the meeting?
Hi, Cynthia. Yes. I'm just reading over my notes one last time before the meeting. I really want the team to get off to a good start. Here's the agenda. I've outlined an agenda here, but I want everyone to feel free to share their ideas. I think everyone has something to contribute, and it's very important when we're making decisions about client care to talk to members of the team that actually are at the bedside.
Margaret, this looks great. I like hearing that it's important to speak up and share my ideas.
I plan to review some information about case management at the start of the meeting.
Interesting.
And while I think most of the team members are familiar with the concept of clinical pathways, I hope this information will clarify the role of case management as it relates to clinical pathways.
Now that we've seen the video, we'll shape this learning opportunity by answering some questions. What are your impressions of Margaret? We thought that Margaret used her skills of decentralized decision-making, which included the skill of distributing decision-making authority throughout a larger group, which in this case was a group of multidisciplinary professionals. We enjoyed seeing how she was inclusive of her staff members while wanting to implement change for hip arthroplasty protocols. Another question is, would you like to attend a meeting where she was in charge? Why or why not? Again, we thought attending a meeting where Margaret leads the team would be great, as she listened to the concerns and suggestions of her team members while giving constructive criticism where needed. In addition to the opinion-based questions just answered, we've also included concept comprehension-related questions, which are as follows. Margaret is leading a work group whose focus will be to implement changes to the care delivery process. What type of change will this be? Is it A, unplanned change, B, planned change, or C, covert change? That's correct. If you selected B, planned change, you're correct. And that's because a planned change is a result of informed decisions based upon the gathering and processing of information about that topic, which is exactly the type of change that Margaret recommended. Next, we've included a question regarding the different stages of change in accordance with Lewin's theory. Margaret recognizes the first step in implementing an effective change is to examine the current process. According to Lewin's classic stages of change, the investigation should occur during which stage? A. The refreezing stage, B. Moving stage, or C. Unfreezing stage. If you selected C, you're absolutely correct. During the unfreezing stage, the problem is identified and investigated. Other team members are made aware of the issue and decide what type of change, if any, is needed. The last question for stage 1 involves the use of the proper change theory for the situation at hand. Margaret anticipates that she may meet resistance about the need for change to improve the quality of care delivered. Which of the following change strategies should she plan to utilize when working with a multidisciplinary healthcare team? A. Normative re-educative, B. Rational empirical, or C. Power coercive. If you thought B. Rational empirical, you're correct. The rational empirical strategy uses current findings to support the need for change to occur. This strategy would be the best to encourage a multidisciplinary team to work together toward the goal of improving client outcomes. Next, we'll view a video of Stage 2, where Margaret discusses her plan for how to implement a new clinical pathway for total hip arthroplasty.
Let's recap. We've talked about who a case manager can be, the fact that case management can help control cost, and how case managers use clinical pathways to monitor client progress. I thought a good place to start would be to develop a total hip arthroplasty clinical pathway. Does anyone have questions before we go on?
So what's this going to mean for my surgeons? It looks like it's going to take away some of the control they currently have over the care of our clients.
And what about the clients who develop complications?
Yes, and sometimes clients don't progress as quickly as planned in physical therapy. Then what?
Before we move on, you might be wondering, what is a clinical pathway? Luckily, our team has been able to come up with a concise definition to aid in your understanding. It's clear from the picture that a clinical pathway involves a screening and assessment, treatment plan, team-based care, achieving targeted goals, and the implementation of ongoing quality improvement. But what purpose does it really serve? A clinical pathway is an evidence-based, multidisciplinary approach to patient care that defines the expected outcome of a particular condition or set of circumstances. Clinical pathways are designed to improve the quality of care and patient outcomes while reducing variation and cost. In the United States, clinical pathways are most commonly used in the hospital setting, though they are also being developed for use in other care settings, such as skilled nursing facilities, home health, and ambulatory care. We'll now move on to our second round of questions, with this first set designed to see how we felt about the happenings of the video. What do you think the gentleman's body language is telling the group? What we thought is that the surgeon seemed closed off to the suggestions the group was making to implement the new strategies. He felt strongly about how his ways are the best ways to treat the patients post-operatively. He placed more importance on the surgeons, more so than the interprofessional team members when considering the new plan of care. Another question is, would you address the attitude at this point? If so, what communication strategies might you use? We thought that it is important to understand the perspective of the surgeon, but not at the cost of the members of the group being offended. This situation would require the assertive communication strategy. It is a communication style that acknowledges and deals with conflict, recognizes others as equals, and provides a direct statement of feeling. A statement emphasizing the importance of each interprofessional team member would be beneficial. This will display that the moderator supports each team member and that she is not going to show any partiality to any certain members of the group regardless of position or rank. To keep the same format from earlier in the presentation, we, again, move on to concept comprehension questions. Margaret, the case manager, is reviewing information about clinical pathways with members of the team. Which of the following information should Margaret include? A. Clinical pathways prevent the occurrence of medical errors. B. Clinical pathways can be altered to meet client needs. C. A variation of a client's progress requires a root cause analysis. If you thought B, you're correct. Clinical pathways are intended as a foundation to standardize care for clients who have similar conditions. Providers retain the ability to individualize the plan based on client characteristics. This next question is about dealing with conflict during the implementation of a new plan. Team members are expressing resistance and concerns regarding the implementation of clinical pathways. What action should Margaret take to increase the team's ability to work together? Is it A, determine the basis for their concerns, B, suggest replacing resistant team members, or C, provide an in-depth explanation of the need for change? If you thought A, you're correct. To effectively change opinion, efforts should be directed toward addressing the root cause of their resistance. In the next video, we'll watch as Margaret maneuvers the different personalities in the room while attempting to showcase her proposal for a new clinical pathway.
Margaret, you said that the team was meeting to discuss a clinical pathway for clients who've had a total hip arthroplasty, right? I thought the current protocols that we were using were working well.
They are, but evidence-based practice shows that the use of clinical pathways decreases cost, improves client outcomes, and reduces a client's length of stay.
I'd like to address the length of stay. As a physical therapist, I know sometimes our team feels rushed in getting clients to reach their mobility goals. We can't start working with the client until the first and sometimes second post-operative day. This just isn't enough time to prepare a client for discharge. And then there are home safety issues.
I think my surgeons are very conscientious and manage the length of stay for each client very well. If a client can be discharged in 3 days, then we discharge them in 3 days. If they need to stay for 6 days, then they stay for 6 days.
I appreciate your comments. Why don't we take a look at a sample hip arthroplasty clinical pathway that I pulled from our education department?
As a representative for the pharmacy department, I'd like to address another problem first. Most of our clients need instruction on self-administration of enoxaparin, and sometimes clients don't receive instructions until discharge. Clients need a chance to practice this skill and provide a return demonstration before going home.
Well, actually, if you look at the post-op day 1 under teaching, you will see that the clinical pathway suggests enoxaparin education begin 3 days before discharge.
Oh, okay. Well, that'll be a huge benefit for our clients.
I agree, but look at the amount of information that clients need to absorb in just 4 days. It's a little overwhelming because you have to assess readiness to learn. Also, sometimes our clients are cognitively impaired due to the analgesics they're receiving, which affect their ability to concentrate and retain information. That's why this teaching often falls on the last 2 days of the client's stay.
One of the problems our physical therapists encounter is that if the timing of a client's medication is off, they're in too much pain to participate in therapy.
Is off? What do you mean?
Sometimes clients have difficulty.
Maria, you said that clients don't always get instructions about how to self-administer enoxaparin until the day of discharge. Why is that happening?
We don't receive the prescription for self-administration until the day of discharge. Also, I think it's the volume of client education that has to occur.
I want to hear what each of you has to say. Can we make sure everyone has a chance to speak? Bailey, you go first. What happens when a client's pain isn't under control prior to physical therapy?
After viewing the video, our team immediately noticed the meeting was not going as smoothly as Margaret would have hoped. We were faced with the following questions. At this point, it feels like the meeting is getting away from Margaret. What could she say to get the group back on track? What specific communication strategies might be most effective in getting the meeting back on track? To regain control of the meeting, Margaret can employ several effective communication strategies, and possibly use specific phrases to guide the meeting back on track. Some of these strategies can include Margaret acknowledging the points made and redirecting, Margaret setting clear expectations of the meeting, for example, topics that need to be addressed and discussed in a timely manner. Margaret can use time management, reminding the team of the time constraints and to remain on topic. And Margaret can use polite interrupting, saying things like, sorry to interrupt, but we need to get back on track so that we remain on time with the discussion and the key points that need to be discussed. This next question employs the use of matching to obtain the correct answer. Both the answer choices and their definitions will be read in a randomized manner. When a work group comes together to accomplish a task, they move through stages in a predictable manner. The stages involve norming, performing, forming, and storming, and their respective definitions in a randomized manner include constructive efforts occur as problems are solved, competition, disagreement, and resistance occurs, cooperation develops, differences expressed and resolved, and expectations defined, directions given. If you thought storming, performing, norming, and forming were the correct order of the steps, you are correct. Storming is when competition, disagreement, and resistance occurs. Performing is when constructive efforts occur as problems are solved. Norming is when cooperation develops, differences expressed and resolved. And forming is when expectations are defined and directions are given. This next question involves strategies Margaret could use to help realign the direction of the meeting. Margaret is implementing strategies to enhance the productivity of the group. Which of the following should she plan to do? A. Add new members to the group as the project progresses. B. Designate the most outspoken members of the group to make final decisions. Or C. Encourage two-way feedback when evaluating the group's progress. If you thought C, you are correct. This method promotes open discussions and fosters progress toward meeting the goals of the group. Moving on. Now, we're going to really make sure that you understand the concepts you were previously quizzed upon. Margaret, the case manager, is meeting with the members of the team. The team members are discussing their opinions about proposed changes to the clinical pathway for total hip arthroplasty clients. The team members' comments indicate that the team is in which of the following stages of group process? A. Forming, B. Storming, or C. Norming. If you thought B. Storming, you're correct. In the storming stage, the members of the group begin to disagree with each other and express polarizing views. The penultimate question for stage 3 involves active listening strategies to aid Margaret during the meeting. Margaret is using active listening to address Bailey's comments about the problems the physical therapist encounters when a client's pain is not under control prior to physical therapy. Which of the following techniques is Margaret using? A. Paraphrasing, B. Open questioning, or C. Framing. If you thought B. Open questioning, you're correct. When the nurse uses open questioning as an active listening technique, she asks questions that begin with what, how, or when to obtain more information about the situation. The last question for stage 3 is about role identification and what that role might entail. Dwight and Margaret are discussing the various roles that the team members of the group assume during the meeting. Which of the following statements made by a group member illustrate the role of gatekeeper? Is it A. Margaret? I want to hear what each of you has to say. Can we make sure that everyone has a chance to speak? Bailey, you go first. B. Beverly. You said that the team is meeting to discuss a clinical pathway for clients who have had a total hip arthroplasty, right? Or C. Patrick. I think my surgeons are very conscientious and manage the length of stay for each client very well. If you thought A, you are correct. A gatekeeper encourages active and open participation and communication by all group members. In the last video for this scenario, Margaret is speaking with Dwight about how the meeting got away from her and what she could do differently in the next meeting to promote a more positive outcome.
Phew. I didn't expect the team to be so vocal.
Yes, everyone was pretty outspoken. It's good to see that they're all passionate about clients receiving proper care.
What did you think when everyone started talking over each other?
Well, at least everyone participated, and we were able to identify a number of areas that need to be addressed. You did a good job of getting them back on track.
Thanks. Now, I'm just still trying to understand what happened in that meeting and how I can do a better job leading the team. Since the team is made up of individuals from 3 different generational groups, it impacts how they respond to the need for change.
I think it's a good idea for you to take that into consideration when you're planning the next meeting. And remember, some resistance to change is normal.
Thanks for your help. Can we talk again in a few days?
Sure, just let me know when.
Once again, after the video, we were posed with the following questions to express our own thoughts and concerns. What are some of the ways Margaret might improve the meeting for next time? We thought Margaret can implement various strategies and tools to enhance the productivity of future meetings. Are there tools and strategies that you've encountered that make meetings more productive? How might you implement the tools and strategies to make meetings more productive? We thought yes, there are tools and strategies that we have encountered such as mindful facilitation, detailed outlines, and assigning responsibilities. Margaret can have a detailed outline to ensure that ample time is allocated for each topic that needs to be discussed. Margaret can assign specific roles to the multidisciplinary team, for example, someone who takes down suggestions or someone who distributes responsibilities. And Margaret can make sure to redirect team members gently when steering off topic by using mindful facilitation, ensuring all members' concerns are heard and valid. Finally, we have our last set of concept comprehension questions. Margaret notes that the team is comprised of a widely varied group of professionals. Which of the following should Margaret keep in mind when considering generational differences? Is it A, millennials are likely to be more accepting of diverse values than people from other generations? B, individual considerations are more relevant than generational differences? Or C, Generation Xers value independence and self-reliance more than cooperation? If you thought the answer was B, you're correct. While generational stereotypes can help one's understanding of group dynamics, it's important to recognize that individuals have their own specific perspectives and needs and do not uniformly conform to these stereotypes. Lastly, we thought we could wrap up by offering suggestions on how nurses can bridge gaps between generations and differing team members in an effort to foster productivity. Nurse leaders can effectively bridge generational gaps and enhance productivity by implementing the following strategies. 1. Gain insight into the motivations of staff members. 2. Establish inclusive workplaces that prioritize hearing and valuing all opinions and ideas. 3. Acknowledge generational differences while leveraging commonalities and strengths to foster team unity. 4. Communicate using the preferred mode of each employee, ensuring the most effective delivery of messages. 5. Capitalize on generational differences to encourage diverse perspectives on various issues. And 6. Promote and facilitate mentoring partnerships, creating opportunities for all employees to learn from each other's experiences and expertise. Lastly, we'd like to end with our references, so that those of you interested in the source material have the opportunity to jot down the resources we've used. We thank you all for joining us on this learning experience, and hope that we were able to present this information in a way that is easy to understand and, perhaps, even entertaining for some of you. On behalf of Luke Sanborn, Lucy DeKellian, Tamara Wilson, and Matthew Denise Yoder, this is Sanveer Sangha. Take care.